Every year, the second Thursday of October is observed as the World Sight Day. This year, that is in 2017, the 12th of October is being commemorated as World Sight Day in order to increase awareness about the issues of low vision and blindness. This year, we aim to achieve the goal of universal eye health. Globally, the World Health Organization estimates that around 285 million people suffer from blindness and low vision. Of these, 39 million people are blind and 245 million people suffer from impaired vision of several degrees. In India, it is estimated that about 18 million people suffer from low vision and blindness. The most common causes of low vision and blindness are refractive errors, cataract, glaucoma, age-related macular degeneration, diabetic retinopathy, as well as corneal blindness. It is estimated that 20% of the cause of blindness in India is due to uncorrected refractive errors. What is refractive error? Normally, the light which enters the eye is focused by the cornea, that is the clear layer in front of the eye, focuses the light on the retina, which is the light sensitive part of the eye situated at the back of the eye. When the light is not focused properly on the retina, we have what is called refractive error. Refractive error is of several types. One is short sight or myopia, where the nearby vision is clear and the distant vision is blurred. Then we have hyperopia or long sight, where the distant vision is clear whereas the nearby vision is blurred. Then we also have astigmatism, where again the light is improperly focused on the retina. Traditionally, the refractive errors are corrected by means of spectacles as well as contact lenses. And the importance of these errors is that it affects mostly children and young adults who are in the most productive age group. And uncorrected refractive errors can often lead to amblyopia or lazy eye, which is again a cause of permanent blindness and visual impairment for these young persons. Traditionally, we have used glasses as well as contact lenses for correction of refractive errors. And with the advent of the latest technology, we are having several laser procedures for permanent treatment of refractive errors. The most important among these laser procedures are the photorefractive keratectomy or PRK. Then we also have the LASIK or the laser in situ keratomiliosis, and the most advanced type is called the customized LASIK. In all these laser procedures, what we do is the cornea or the clear layer in the front part of the eye is subjected to excimer laser rays, and these rays alter the curvature of the tissue with a precision up to a micron. And this corrects any refractive error and the light becomes properly focused on the retina, leading on to clear vision. Now, in photorefractive keratectomy, we remove the corneal epithelium or the thin covering of the cornea, and the laser is applied on the stroma and the refractive error is corrected. Whereas in LASIK, what we do is we make a flap of the cornea using a microkeratome. It is an instrument called the microkeratome, or we can also use a femtosecond laser to create a flap of the retina, and the flap is removed and we apply laser on the corneal stromal bed and the flap is replaced. Now, the main difference between photorefractive keratectomy or PRK and LASIK is that in PRK, the visual recovery takes several days or weeks to occur, whereas in LASIK, since we are replacing the stroma immediately, stromal flap is replaced immediately. So this causes instantaneous clearing of vision, and the recovery time is very less in LASIK. Now, in customized LASIK, it corrects the very minutest refractive errors of the eye by measuring a three-dimensional wavefront map of the corneal surface, and any small refractive errors are corrected, and the customized LASIK gives the clearest vision as well as the clear night vision. All these procedures are daycare procedures That is, they do not require stay in the hospital. Patient can leave the hospital on the day of surgery itself. There are certain criteria for being eligible for the laser procedures. You have to be above 18 years of age, and your spectacle number should remain unchanged for 1 year period. Also, you should not be suffering from any eye diseases like keratoconus or glaucoma. Your corneal thickness should be adequate, as well as your retinal evaluation or the nerve of the eye should also be properly evaluated by the corneal surgeon prior to the surgery. Only after a detailed evaluation will you be eligible for the laser refractive procedures. Following the procedure, as I said, the recovery is almost immediate, but you will require to use eye drops for up to a month after the surgery, and also you can resume all your daily normal activities, but you have to refrain from contact sports and swimming for a period of 1 month following refractive surgery. So, if you are suffering, any person suffering from refractive errors, and if the person is above the age of 18 years, you can contact your eye doctor, the LASIK surgeon, and after proper evaluation, you can proceed with the refractive surgery, and you need not let the refractive errors hamper your normal living.